I am Dr. Syed Hafissudin. I am working in here in Family Medical Center as a general practitioner past 9 years, and we see around 50 to 60 patients per day as a general practitioner. And here today, and this clinic is comes under the Anglo-Arabian Healthcare Group, and today we are going to talk about the effect of vitamin D on COVID patients. Okay, here I would like to say that vitamin D is very common all over the world, especially in the Middle East, India, and other Mediterranean countries. Here the sunlight is very much available, but people don't go out in the sunlight. They are always covered in the full clothes from head to toe. That's the main reason why vitamin D is more prevalent here. And secondly, the diet. The people don't use a lot of fish and milk products. And third one is sedentary habit, and mostly they are indoors, and they don't go out in sunlight. And even if they go out, they are covered all the time. So the prevalence is more in females, especially here in the Middle East. There was a study conducted in Israel in Galilee Medical Center. It's called PLOS 1. That was published in February 3rd, 2022. This was done from April 7, 2020 to 4th of February 2021. Around 1,176 patients were examined, and out of this, they found that most of the patients were having vitamin D less than 20 nanograms this per liter. This is 14 times more. And then this vitamin D deficiency, and they related this to COVID mortality and morbidity, and they found that the patients with less vitamin D are more prevalent more prone for COVID-19 mortality and morbidity. It is found that vitamin D is associated with most of the autoimmune disorders, cardiovascular and infectious diseases, and even the diseases related to lung are more prone for this vitamin D deficiency problems. Due to vitamin D deficiency, all these cases, they don't respond properly to the treatment unless the vitamin D is corrected. And this vitamin D is more prevalent in Middle East than other countries. Even in India, Singapore and other places it's there. Even US and Canada, 40 to 50% of the people are suffering from vitamin D. The main problem with the vitamin D is in children it is found as rickets, and in adults it's found as osteomalacia, where in rickets you'll find the bowed legs in children, and in osteomalacia you'll get the bone weakness, mineralizations, less of mineralizations and all. Then this vitamin D is available mainly in the sunlight, and then in the fishes and the milk and milk products. So people should be encouraged to use these more. And then this for the treatment, vitamin D is if it is suppose less than 20, then the 20 to 30 is supposed to be insufficient, and less than 20 is considered as vitamin D deficient. So treatment should be supplementation of the vitamin D, and in the children it can be given as 2000 IU per day, and in adults in 50,000 IU per week. And maintenance is usually 400 to 1000 in children and 600 to 6,000 to in adults. Okay, the prevention part. In the prevention part, mainly the people have to expose themselves to sunlight with less uh, number of clothes, or the whole skin should be exposed to the sunlight, and that timing should be from 10 a.m. to 3 p.m. and it should be full body sun exposure. And one setting of the full body sun exposure gives around 10,000 to 25,000 international units of vitamin D, which is a lot as compared to taking medicines. That will take a long time. And there's another factor which affects vitamin D deficiency is the increased pigmentation, aging, and sunscreen use. And this recommendation should be the fortified food like milk, cereals, and even some other fruit juices fortified with vitamin D can be given. That will help a lot. And lastly, it's also noted that vitamin D is associated with dizziness or vertigo and the lower respiratory tract infections also. All this can be avoided with the vitamin D supplementations and treatment. Okay, as far as the toxicity is concerned, suppose vitamin D is ingested in large amounts for long time, you do get toxicity if it crosses the 150 nanogram per ml level. The toxicity gives rise to hypercalcemia, hypercalciuria, and nephrocalcinosis. And this effect can be avoided by frequent checks of vitamin D and stopping vitamin D external if they are taking it. And this septic patients, they have seen that they have high mortality with the low vitamin D circulating levels. And this in patients, hospitalized patients are found to be associated with prolonged hospitalization. Mortality is more in vitamin D patients. And this gestational diabetes and low birth weight and preeclampsia, they are also reduce this vitamin D things. And this conclusion, we would like to say that vitamin D is an essential part of our diet, and we have to include vitamin D in our diet, and the sun exposure should be good, because since vitamin D is associated with lot of conditions where the mortality and morbidity increases of any illness, especially if there are chronic illnesses are there, and at this present age of COVID-19, which is directly related to high mortality and morbidity of COVID-19 patients. So vitamin D should be taken care of first. And this is very easy, just take tablets regularly and then it will be okay. Thank you.